to hear you. I'm even happier that you could hear us.
Yeah, that's great. Thank you,
It
Jason.
is, man, because Sabrina just had all kinds of tough questions for you. That's why.
Oh, great.
What we have to do technically is we have to kind of tap in and harness some of the feng shui that Melanie has in her office and the workspace, and that improved the audio quality. So it works.
Right on, Melanie. So I was looking at the last time we had you on. It was a couple weeks ago. So we wanted to kind of just start with an update. Of course, as you guys might or might not recall, there was a state of emergency declared at the Child Protective Services, and they folded in DYA Director Melanie Brennan. There was a backlog of some hundreds of complaints during the pandemic, and so last time we spoke, they were wading their way through that list of complaints, and also we're trying to move forward and set everything up because obviously it wasn't just that; it's a lack of staff. There's a whole bunch of issues with CPS that she's kind of having to go in on. So, Melanie, I guess it would just start with a general update. That'd be great.
Okay, well, I think the last time we spoke, or actually the last time I was asked, was how many of the backlog had we gone through? And I'm happy to report, as of last week, we completed vetting the entire over 900 cases. And of those 900 cases, at this point, as of yesterday, approximately 600 were open, linked to services, and closed off. And the other remaining 300 some have been divvied up and are in some type of work with Child Protective Services, either being case managed properly now or just being referred for additional support services, or some are still under investigation. So the backlog has been addressed.
What about new cases and new referrals?
So when we came in January, Sabrina, what we did was we took the remaining backlog. We took the backlog and we started working with just the backlog. But when we realized, like, okay, we're creating a backlog with incoming referrals, what we did was we asked the CPS retirees that are volunteering their services to really work with the backlog, prioritize the backlog, so that DYA social workers and the current CPS social workers could attend to the new and incoming referrals. And so we wanted to make, a real effort at trying to see if it was possible to not create a backlog with incoming cases. And we were able to do that. Honestly, we really have to thank the CPS retirees for helping vet those 900, actually 700 referrals, because by the time we were there, we had done already 213. And so that total of 900, of a little over 900, was like a combined collaborative effort, but we really were concerned about the incoming referrals and just being able to address that. So that was also our focus, as well as trying to onboard and recruit new employees.
So where are you with hiring?
With the recruitment efforts, we have 2 individuals that came on board couple weeks ago. We have another 3. Their start date is March 29th, and we are still going through the regular GovGuam recruitment process, trying to fill all the vacancies. And again, although DYA was brought in to collaborate with CPS and to help them with the backlog, we're not going to go away anytime soon until we make sure that the manpower situation is resolved so that this doesn't reoccur.
Right. And you've said it on the show when you've been on, and I think even in conversations with previous individuals who were with CPS, that staffing has always been a major problem, and maintaining and keeping them there, because the nature of the job, it's just so stressful, and it's just hard to hear what these children are going through. And so in that sense, what kind of programs do you have in place for the staff that you currently have, I guess, to help them cope?
To mitigate them.
Yeah.
Yeah. So obviously, it has been an ongoing problem. CPS has been an overall agency for many years, for decades even. And so having this cross collaboration with Department of Youth Affairs kind of identifies or reminds us that there is a connection between child maltreatment and subsequent delinquency. I mean, we know that child abuse, victims of child abuse are more likely, are at a higher risk to get involved later on with crime and delinquency. I mean, it's not an inevitable relationship, but it definitely is a risk factor. And so really our best defense against juvenile delinquency is really to strengthen and solidify our child abuse prevention work. And so I think that that the cases coming in, we need to tend to them, regardless of whether there's indicated child maltreatment, regardless of whether it fits the criteria, but just linking families and children to services is huge in terms of prevention. And it can prevent a lot of these cases from becoming full-blown child abuse cases. And so with that, it's our work in prevention really needs to be fortified, solidified, and our work with incoming social workers assigned to Child Protective Services, we have to do our best to properly onboard them, not to throw them into the fire, but prepare them, give them, the skills, the coping skills and interviewing techniques that they need.
Mm-hmm. One other thing, since you've come on and since you've taken over, you really made this push to try and get more people to step up and to be foster parents. Are you seeing a response? Are people calling and saying, I wanna help?
Yeah, there have been quite a few calls already, and we are right now processing 3 new foster parents to license them so they can take in children. We're always going to push the fact that our island community, the family structure, really, whenever we have to make that hard decision to remove children from their families, we want to make sure that we exhaust all efforts to examine, extended family, grandparents, aunts and uncles before we actually have to move them into a licensed foster home. So we really do rely on kinship placement, on relative placement. But yes, there's always going to be a need for foster parents. And so we continue to make that push out there in the community. And again, every time I'm on the radio, I always make it a point to say that, if anyone is still interested, to please call us at 475-2653. There's always going to be a need. And in fact, since we've come on board, the number of children in foster placement when we first came on board, I believe was 380. Now we are at 404 children in some level of foster care. And so with that, it's trending like by the end of the year, we could reach 500. So yes, there's always going to be a push. Some of our social workers have, do their own pushes within their churches, within their communities. But yeah, anytime I have an opportunity to inform the community and to ask the community, I will go out there and ask, like, if you're interested, please call us.
Do you guys need any sort of like donations or anything for the children that are referred?
Yeah, there's often donations, and there are a bunch of nonprofits that we work with, including Catholic Social Services, Manatlu, Harvest House, and they receive, and they are so generous in giving to the children under our care.
Okay. Well, yeah, just let us know if you need us to put out the word, And
well, thank you. Yeah, we will. In fact, we're gearing up for April. It's a busy month for us. And it's a busy month for the community because we are partnering with the Guam Coalition Against Sexual Assault and Family Violence. We actually have been on a planning committee because April is Guam Family Recovery it's the Sexual Assault Awareness Month. It's National Child Abuse Prevention Month. It's also a Youth Month and Crime Victims Week. And so rather than going on alone and getting resolutions, we've decided to partner with them together. And so April 1st is our 2 p.m. Zoom proclamation signing. So yeah, getting the word out on April being a busy month for us.
Mm-hmm. Any update on the foster home?
Oh, you know what? Last we spoke, it's basically still status quo. We're waiting for a part. Contractor needs to put it to install it, and then we need to see how that will be with Guam Waterworks, if we'll have enough pressure to open and operate.
I wanted to move over to DYA now, and it's something when you, I think it was one of the first or second times you came on, we were talking about that reentry program and how you guys were
Yes.
working on it. What's the update with the reentry program?
So I think last we spoke, we were applying for a grant to set up the Guam reentry program, and it was an OJJDP grant that for some reason it was suspended, and we're waiting for an open solicitation date. What the juvenile reentry program will do, it's about working with kids while they're detained at DYA to ensure that by the time they walk out, that they have coping skills, they have the support necessary to achieve, a better outcome. So what it means is, before, or actually currently, what we do is a child comes to the Department of Youth Affairs, and the stay is just based on really a court order. And what we do with the child, of course, the youth is assessed. We do have a contact therapist who does an assessment and recommends treatment, or whatever the child might need, the youth might need. And so what we're currently doing is we have social workers that work very intensely while the youth is detained. But what we don't really have is, and where we see a gap, is leaving the Department of Youth Affairs. There really is no follow-up with the Department of Youth Affairs. The child is ordered to be released, so he's released back to his community, but there is no follow-through. And so what reentry proposes to do is to follow that youth out back into the community to ensure that he has a place to stay, that if he's not, I guess, ready for or willing to go to school, or has aged out, that we set him up to succeed somehow with either workforce development opportunities, even if it's helping him to fill out an application for housing. That's what reentry is about, helping to stand up formerly incarcerated individuals. And I know that the Department of Corrections has stood up a reentry program, and that's what we'd like to do for our juveniles.
Right. What about, speaking of the Department of Corrections, we spoke with them yesterday, and we asked about whether or not they have begun vaccinations of the prisoner population there. I'm not sure if, DYA is having any sort of conversations with public health on the client population over there. Is that happening, or that's not in plans for?
Well, as the vaccinations has been opened up for younger individuals on Guam, that will be a conversation. We still have some of the youth that we spoke about when there was an outbreak. We still would need their parents' permission, authorization to get vaccinated. And so there has been discussion about that, but no movement yet in terms of actually getting the vaccinations out to our resident population. We still have measures in place wherein anybody who is admitted to the Department of Youth Affairs does receive or is tested upon arrival and is quarantined for 10 to 14 days prior to being mixed with the general population. So safeguards are still in place, but that discussion about having kids tested, that's still a discussion that needs to be made with public health.
Okay. Thanks, Melanie.
Yeah. How long do you anticipate the state of emergency lasting for CPS?
Well, again, just because we don't have the manpower resources, all set in place at this time, and the recruitment, it's for whatever reasons, because it's, a difficult position to fill, and because the recruitment process, it's really vetted, and so it does take 2 to 4 weeks. So I anticipate the Department of Youth Affairs social workers being there at least another month.
Okay.
Well, thanks, Melanie, for the updates. Was there anything else?
No, just next month is a busy month. April
Yeah.
1st is a proclamation signing. We've joined forces with the Guam Coalition Against Sexual Assault and Family Violence. It is Child Abuse Prevention Month. It is Youth Month, and so very, very busy. But there is, that connection between child maltreatment and delinquency, and the better we are at the front end in terms of prevention, the better we are and the safer the community will be. It's not just an effort by the government or one organization. It really takes the whole community to address child maltreatment and delinquency.
Right on.
Hopefully we can get you on next week, and also Cynthia, right? That's Cynthia Cabot.
Yes,
Yeah.
that's Cynthia.
Yeah.
She's a great partner. She's
Right.
always offering us training. She's always helping us develop professionally, and that's important so that we can better address, these systemic and issues that really are just so overwhelming at the moment.
Thank you, Melanie.
Thanks, Melanie.
Thank you too.
Okay.
We'll see you.
Adios.
Okay, hasta. 7:25. Coming up, Speaker Teresa Lahi